Hi, my name is Murundano. I'm here to discuss psychiatric emergencies. I'll specifically talk about how we can provide nursing interventions for specific psychiatric emergencies. So, psychiatric emergencies, according to my definition, are acute disturbances in thought, behavior, mood, or social relationship that require immediate intervention as defined by the patient, family, or social unit to save the patient and or others from imminent danger. So from this definition, we can simply tell that psychiatric emergencies are situations that put the patient at risk of harm to self and others, and these situations require immediate intervention by professionals. Okay. Such are psychiatric emergencies. So think of any situation in a psychiatric unit or in a psychiatric environment in the psychiatric unit that can put a patient at risk of harm to self and others and will need immediate intervention by health personnel. Such situations are psychiatric emergencies. Okay, so on the next slide I have a list of psychiatric emergencies. You have to know what are the different types of psychiatric emergencies. For you to be able to manage a condition, you have to know what it is. Okay, so I have not discussed these conditions in details. I'll just give you a list and give you tips on how you should handle each one of them as you discuss in your essay. Okay, so we have a number of psychiatric emergencies, and in this presentation I've just talked about a few of them. And the first on my list is acute depression. Okay, acute depression qualifies to be a psychiatric emergency because it usually puts the patient at risk of self-harm and harm to others. If they are not attended to urgently, this patient may end up committing suicide or attempting to harm himself because of the depression that they have, because of how they are misinterpreting their situation around them, okay, or whatever they perceive to be a bad situation. So you need these clients usually need urgent care. Okay, the second one on my list is alcohol intoxication. Alcohol intoxication qualifies to be a psychiatric emergency because it also puts the patient at risk of death, and it also puts the patient at risk of harm to others and self. Mostly this patient is at risk of death because most of the systems, all the body systems are usually affected, and most of the patients usually come in an unconscious state. This patient will be at risk of aspiration of their own vomiters, and their vital signs might be depressed. So this patient, and usually the patient is unconscious, and that puts this patient at high risk of death. So they need urgent intervention. Okay, they will usually need urgent intervention. Third one on my list is delirium. Delirium, this is a condition that is usually caused by a substance abuse, okay, or abuse of any other drugs. So this condition has a cause as well, and usually the patient is restless and they are not cooperative, and they might harm themselves and others as well. So this kind of a client needs immediate intervention by professionals. Okay, the fourth one on my list is aggression. An aggressive patient is somebody who needs urgent care as well. This condition qualifies to be a psychiatric emergency because this when the patient becomes aggressive, they are at risk of harming themselves or others in that environment. And this patient is not unconscious, they are actually very much conscious, and they may have a lot of energy. So you need to be very cautious. Your main aim actually your main area of focus here is to make sure that the patient is safe and other people in that environment are also safe. This aggression may be directed towards someone else or the fellow patient, or just aggressive to self. So you have to be of course provide that nursing care. We are going to see how we can intervene in such a situation. Substance abuse. Substance abuse, this could be abuse of substances such as marijuana, cocaine, etc. Any drugs that can overexcite the patient. Okay, so when the patient is abusing drugs, of course, they become overexcited and they usually become delusional and they have hallucinations, and they'll be misinterpreting and positive stimuli in the environment, and this patient may become aggressive and they may end up harming themselves as well. So this type of a client usually needs immediate intervention as well. The sixth emergency on my list is panic state anxiety. This qualifies to be a psychiatric emergency because this patient may usually become uncooperative and is usually in a panic state because they are afraid of perceived danger. Okay, they are afraid of their perceived danger. They perceive a dangerous situation and they become out of control. They become too anxious and they get out of control, that their aim is to either fight or to run away from the perceived danger. Okay, so usually the patient is not cooperative and you really have to attend to them immediately and help them calm down. Okay, so in this situation, your main aim is to prevent any harm to the patient, any harm to self, and any harm to others as well, and just make sure that the patient calms down. Okay, the seventh one on my list, and this one is very important, suicidal attempt. You really have to talk about this when you are discussing psychiatric emergencies. This one, suicidal attempt is this one qualifies to be a psychiatric emergency because you are dealing with a patient who is trying to take his own life. So you have to put in precautions or measures immediately that will prevent this patient from taking his own life. Okay, so the patient may be using any available means to just take his own life. So you need to intervene immediately in order to manage this patient in such a situation. So if you have a patient who attempted suicide in that environment, they may come in an unconscious state, or they may have been brought in fully conscious, but you have to handle the situation as an emergency. Okay, so each hospital has a protocol, of course, of how to handle such situations. In the next slides, I'm going to discuss, I'm going to give you tips of how you need to handle such situations. Okay, what information should you include in each of these conditions as you write down your essay. I've given you a sample of a question. I got this question from one of the past papers. It's saying discuss the nursing care interventions of 5 psychiatric emergencies. So this question was allocated 50 marks only. So you have to choose 5 psychiatric emergencies, list them down, and under each of them you have to discuss nursing interventions. Okay, how are you supposed to answer such type of a question? You have to identify the psychiatric emergencies and list them down, then discuss your nursing interventions under each of them. Okay, so you have to list them, then discuss your nursing interventions under each of those emergencies that you've identified. Okay, let's begin with alcohol intoxication. We have identified a psychiatric emergency, which is alcohol intoxication. Now let's discuss the nursing management for the nursing interventions for this condition. So you do not have to start writing subheadings under this condition to say environment, safety of the patient, blah blah. You just have to talk about the interventions that you are going to put in place for this patient. Okay, no need of subheadings. So for alcohol intoxication, you have to assess the level of consciousness, ability to speak, response to stimuli, and commands. Okay, this is a patient who usually comes in an unconscious state. So this patient will also need resuscitation. But before you carry out your resuscitation, you should do an initial assessment. Carry out an initial assessment on the patient. This initial assessment will comprise of vital signs, where you take the blood pressure, pulse, respirations, and the other important assessment that you have to take is random blood sugar levels. So you have to take, you have to measure the blood sugar levels of the patient. Then under resuscitation now, you need to talk about the airways, the breathing, circulation, and the drugs that you're going to administer to this patient. Under airways, you need to just mention of, you have to mention that the airway must be clear, the tongue must not be falling back. This is a patient who's unconscious, so make sure that the airway is patent. If there are any secretions, you have to aspirate them. You have to suck those respirations out using a suction machine. Then you have to talk about the breathing now. Breathing, you will just have to make sure that the patient's respiration is within normal range. If the patient is not breathing adequately, that will mean there is inadequate oxygen supply. So you have to put the patient on oxygen. Okay, put the patient on oxygen. Then circulation, you need to do an assessment. You have to assess the extremities and the membranes and make sure that there is no cyanosis, which is the bluish discoloration representing lack of oxygen supply. So when you assess that circulation, you just want to see whether there is adequate blood supply to the vital organs of the body. So if you see that there is no adequate blood supply, you have to, of course, put in some interventions. Okay. Under circulation, you can also talk about cannulation of the patient. Cannulation, where you have to insert an IV line. You have to insert an IV cannula, where this patient is going to receive some fluids and drugs from. Okay, this is a patient who is intoxicated with alcohol. He will need to be rehydrated, and he will need to be receiving some drugs, of course, for detoxification, because this patient is going to be experiencing what we call alcohol withdrawal symptoms. He will need to go through the detoxification process where the alcohol levels in the blood are going to be reduced. Okay, so you need to discuss all that under this topic. Now, you have to remember one very important point. Under such psychiatric emergencies, don't waste time talking about the subsequent care. It's not important. Talk about the immediate care that you are going to give here. Don't write subheadings. Just bring out your interventions, whatever you are going to do on this patient who is intoxicated. That's all. Okay. I think what I've discussed so far is enough to fetch me 10%. Okay, but you can, if you still have enough time, you can talk about a lot of things. You can also mention the drugs that you are going to give this patient, the fluids, the type of fluids that you are going to give this patient. You can mention them as well. Okay, for such detailed information, you can refer to my presentation on alcohol intoxication. Okay, the other psychiatric emergency I would like to discuss is a suicidal attempt. And for this condition, we have a client who tried to take his own life. So this client will need close supervision in everything that they do. They'll need close observation. Okay, our main priority here is client safety. Actually, want to make sure that this client is safe. So firstly, you have to assess the level of consciousness of this client, and if the client is unconscious, you have to take initial vital signs, initial assessment, where you take vital signs like BP, pulse, respirations, okay, to just make sure that the patient is alive.
Then if the patient is unconscious, of course, you have to do resuscitation, where you have to look at the airways, the breathing, and the respiration. So for this one, since we are not informed whether the patient is unconscious or is conscious, you just mention to say if the patient is unconscious, you have to resuscitate the patient. Okay. Then this patient must be nursed in an environment that is in a room that is close to the nurse's bay for close observation. This is a patient who is trying to harm himself, to take his own life. Okay. And this patient's unit should not have any object or item that he can use as a weapon, such as glasses, any sharp objects or loose cords. You have to remove them from this unit. Okay. Just make sure that the environment is very safe for this patient. When giving medications also to this client, you have to make sure that you supervise the patient and he takes the medication in your presence. Because once you just give this patient drugs and let them take on their own, he might be keeping these drugs so that he will have enough drugs to overdose himself. So you need to supervise him as he takes the medication. And you also have to carry out some frequent searches of the patient's unit to just make sure that there are no drugs or other items that the patient has in order to take his own life. Okay. On close observation, you have to at least visit the patient's unit every after 15 minutes. You have to check on the patient. And then this patient may need close observation, as I said earlier, so he will also need company to the bathroom. Each time he wants to go to the bathroom, you have to accompany them. Okay, you have to escort them. Your visits to the patient's unit must not be predictable. They have to be unpredictable at irregular intervals. Okay, especially at night and toward the early morning, at change of shifts or other predictably busy times for staff. You have to be visiting this patient. There's a lot that you can talk about under suicidal attempts as well, but I think these are the most important points on nursing interventions that you can discuss. Okay, of course there's no need of writing subheadings as well here. Just talk about the nursing interventions under suicidal attempt as a main heading.
Okay, so let's talk about acute depression. What nursing interventions can we talk about here? Okay, so you have to understand what acute depression is. This is a patient who is in a very low mood. Okay, so the first things first, I think you have to create that relationship with the patient to make sure that you create what we call the nurse-patient therapeutic relationship. The patient must be able to trust you in order to work with you or cooperate with you. Okay, so after creating that relationship, which is very, very important, then you can, of course, engage the patient in a therapy that you want to give them. Okay, so this patient will need psychological care, a lot of psychological care, where you need to hold some counseling sessions for this client and at least find out what is making this patient become depressed. Okay, if you are certain the cause of the patient's depression, at least it's going to be easier for you to know how to handle the situation. Okay, so you have to provide the psychological care and answer patients, attend to patients' fears, and at least help the patient find a solution to their problem. You have to help this patient find a solution to their problem. Mostly, patients become depressed because they feel hopeless about the situation, that they cannot manage to handle it. They feel hopeless, they feel useless. So you need to also help boost this patient's self-esteem. Okay, you have to count them as important. Do not be judgmental. Make sure that you are honest, but do not be judgmental. You have to accept the patient as he is. You have to convey an accepting attitude and enable the client to express feelings openly. That's very, very important. If the patient is able to express his feelings openly, at least he'll be able to relieve himself of his own fears, and that depression is going to start reducing. So you also have to encourage this patient to express his own anger, the anger that they have. They should not be holding it to themselves. Let them express it. Do not become defensive if the initial expression of anger is displaced on you as a nurse. If this patient is displacing his anger on you as a nurse, you do not have to become defensive. Let the client express his anger so that he is relieved of such bad feelings. So you can also encourage this patient to reach out for spiritual support during this time in whatever form is desirable. Assess spiritual needs of the client and assist as necessary in the fulfillment of those needs. It's very important. Your priority again for this type of a client is to just make sure that the client is safe and that they decide on a solution to their problem. Of course, you have to find out what is causing their depression or what is making them become depressed, and then you help them find a solution to that type of a situation. This patient is fully awake, fully conscious, and they do not need resuscitation. Okay, remember under this one also, do not write subheadings. Just talk about what you'll be doing for the patient in order to nurse them. Alright, so let's talk about panic attacks. Okay, when a patient has panic attacks, he is in what we call fight or flight mode. In this mode, the patient is either trying to fight in order to defend his territory, or he's trying to run away from the perceived danger. Then if the patient has such attacks from an environment where there were a lot of people, you have to move this patient away from that environment and take them to a calm environment. I think this is the first thing that we have to do. Take this patient to a calm environment where it's quiet and there's no too much noise, with low lighting at least. That's a non-stimulating environment. It's very important that you talk about it. Okay, then you have to build that trust with the patient. The patient must be able to trust you. They have to be able to trust you in order to cooperate with you. Okay, and maintain, therefore you have to be non-judgmental. Do not judge the patient. Maintain a calm approach, and you have to encourage and reassure those around the patient, because anxiety is known to be infectious. Okay, if you do not calm those people who are around the patient, they may also become anxious. Okay, so you have to calm them down as well. Then you have to talk about reassuring the client. You should always reassure the client of his safety and that you are there in order to make sure that they are safe. Okay, do not leave the patient. Reassure the patient that you are there with them until they feel better. You will not leave them alone. Okay, so be with the patient. If the patient is pacing around, do not ask them to sit down. Allow the patient to pace around as much as they can. If possible, you actually have to be pacing around with the patient as well. Okay, move around with the patient and reassure them that you are there to make sure that they are safe. Okay, so do not restrain the patient. Don't use any restraints, whether physical restraints such as chains or chemical restraints. Don't use any restraints on the patient. It's not necessary. Do not leave the patient alone when in such an attack. You have to be with the patient at all times. Okay. Then the other most important thing is you have to help the patient adopt good relaxation techniques that are effective for him, such as breathing techniques. So teach the patient such simple but effective relaxation techniques, okay, to help them relax. Remember, under panic attacks as well, do not write subheadings. Just write the nursing interventions that you have to talk about. Okay, so the other condition, psychiatric emergency, that I would like to talk about is delirium. My nursing priority for this condition is maintaining client safety. This is a client who is confused. The client is restless. The client has got hallucinations. The client may have delusions. Okay, the client may not be cooperative, and he may be violent actually. So my main priority here is to maintain safety. So I have to nurse this patient from a very safe environment where there are no items that the patient can use to harm himself or others. Okay, then I have to nurse this patient in an environment that is less stimulating. Okay, this environment should not be very stimulating. It should have low lighting, few people, simple decor, and low noise levels. Okay, because anxiety increases in a highly stimulating environment. Okay, then I should have adequate staff members in that ward where I'm nursing this kind of a patient from. When there is need for physical confrontation, I should be able to call for help, and people should come and help me out. Okay, so never try to be a hero. When this patient becomes uncontrollable, he gets out of control, you need to call for help, call for assistance, and other staff members should be available to help. Okay, so you have to stay calm and reassure patient, maintain a calm manner with the client, and attempt to prevent frightening client unnecessarily. Provide continual reassurance and support. Okay, so do not frighten the patient unnecessarily. You always have to provide that continual reassurance and support. You have to medicate and restrain the patient as per hospital policy. So according to the hospital policy, you can restrain this patient. You can provide some medical tranquilization to this patient and soft restraints as prescribed by the physician. This is usually for protection of the client or other during the periods of elevated anxiety. This patient must be observed also for suicidal precautions. If the patient is actively suicidal, you have to closely observe this patient and observe all those precautions of suicide. Okay. You have to teach the relaxation exercises to intervene in times of increasing anxiety. So you have to teach this patient some relaxation exercises like taking deep breaths, hyperventilation, to just help them relieve the anxiety that they have. Okay, teach prospective caregivers to recognize client behaviors that indicate anxiety is increasing and ways to intervene before violence occurs. So you also have to teach other healthcare members in that environment so that they'll be able to identify, they'll be able to recognize the client behaviors that usually indicate that the anxiety is increasing, and they should be able to intervene before violence occurs. Okay.
So that's the end of my short presentation. I was just giving you a glimpse of how you should respond to such a question when it comes. Okay, so we have talked about a few psychiatric emergencies that you can discuss that are found under psychiatry, and how you can write your nursing interventions under each of them. Remember, the most important point is that you do not have to write subheadings under each condition. Okay, what I mean by subheadings is when you identify to say the condition is acute depression, then you start writing subheadings like environment, psychological care. That is not necessary. Okay, you have to remove those. Just write the nursing interventions that you think are applying for that condition only. If you forget what you should talk about under immediate care, of course you can talk about anything else, even subsequent care, as long as the target is managing the condition that the patient has. All the best. Thank you.